Understanding stomach viruses, symptoms, remedies, and recovery: feeling nauseous, weak, and running to the bathroom every few minutes. A stomach virus can hit hard, leaving you drained and miserable. This common illness, known as viral gastroenteritis, is often caused by viruses like norovirus or rotavirus. These pathogens typically spread through contaminated food, water, or close contact with an infected person. The infection can strike suddenly, making even simple tasks feel exhausting due to dehydration, fatigue, and gastrointestinal distress. However, relief is within reach. By understanding the symptoms, implementing effective home remedies, and knowing when to seek medical help, you can speed up recovery and regain your strength. Stay with me as I break down everything you need to know, from early warning signs to step-by-step treatments, so you can feel better as quickly as possible. Recognizing the symptoms of a stomach virus: the symptoms of a stomach virus often appear suddenly and can be intense, causing significant discomfort. Early signs typically include nausea and vomiting, which make it difficult to keep food or liquids down. This can quickly lead to dehydration, especially when combined with diarrhea, frequent, watery stools that result in further fluid and electrolyte loss. Stomach pain and cramping are also common as the digestive system becomes inflamed. Additionally, fever and chills may develop as the body fights off the infection. Severe dehydration can cause dizziness, extreme fatigue, and muscle weakness, making it essential to act quickly. Instead of waiting for the illness to pass, proactive measures like drinking fluids, resting, and eating bland foods can help your body recover faster. Monitoring these symptoms closely ensures you take the right steps toward healing before complications arise. Step-by-step home remedies for recovery. 1. Hydration is critical. Dehydration is one of the biggest risks with a stomach virus, so replenishing fluids is crucial. Drink small sips of water, electrolyte solutions like Pedialyte, or diluted sports drinks frequently. Large amounts at once may trigger vomiting. A simple homemade rehydration solution can be made by mixing 1 liter of water, 1/2 teaspoon of salt, and 2 tablespoons of honey to restore lost minerals. Avoid sugary sodas, caffeine, and alcohol, as these worsen dehydration and irritate the stomach. 2. Gradual reintroduction of food. Once you can tolerate liquids, slowly reintroduce bland, easy-to-digest foods. The brat diet, bananas, rice, applesauce, toast, is ideal because these foods are low in fiber and help firm stools. Start with clear broths or herbal teas before moving to soft solids. Avoid dairy, fatty, or spicy foods, as they can aggravate symptoms. 3. Rest and gentle movement. Your body needs energy to fight the virus, so prioritize rest. Avoid strenuous activity, which can worsen fatigue and dehydration. Light stretching or deep breathing exercises can help maintain circulation without overexertion. 4. Natural remedies for symptom relief. Ginger tea or chewing raw ginger can reduce nausea. Peppermint tea may ease stomach cramps. Warm compresses on the abdomen can relieve pain. 5. Over-the-counter medications. Used wisely, anti-diarrheal medications like loperamide should be used sparingly, as they can prolong infection. For fever or aches, acetaminophen is preferable to ibuprofen, which may upset the stomach further. When to seek medical help. While most stomach viruses resolve on their own, certain symptoms require immediate medical attention. Severe dehydration, extreme thirst, dizziness, no urination for 8+ hours. Blood and vomit or stool, indicating possible internal bleeding. High fever, over 102 degrees Fahrenheit, that doesn't respond to medication. Symptoms lasting beyond 3 days, suggesting a bacterial or parasitic infection. If you experience these warning signs, seek medical care promptly to prevent complications. Preventing the spread of stomach viruses. Since stomach viruses are highly contagious, taking proper precautions can help protect yourself and others. The viruses spread easily through contaminated surfaces, food, or close contact with infected individuals. Always wash your hands thoroughly with soap and warm water for at least 20 seconds, especially after using the bathroom or before handling food. Disinfect high-touch surfaces like doorknobs, countertops, and electronics regularly using a bleach-based cleaner or other EPA-approved disinfectants. If you're sick, avoid preparing food for others and stay home until at least 48 hours after symptoms subside. When caring for someone with a stomach virus, wear gloves when handling soiled linens or clothing, and wash items separately in hot water. These simple but effective measures can significantly reduce the risk of transmission in households, workplaces, and public spaces. Understanding the difference between stomach viruses and food poisoning. While stomach viruses and food poisoning share similar symptoms, there are key differences in their causes and progression. Viral gastroenteritis is caused by specific viruses and typically develops 12 to 48 hours after exposure, with symptoms lasting 1 to 3 days. Food poisoning, caused by bacteria like Salmonella or E. coli, often appears within 2 to 6 hours after consuming contaminated food and may last just 24 hours. Food poisoning symptoms tend to be more severe but shorter-lived, while stomach viruses usually cause milder but more prolonged discomfort. Both conditions require similar treatment approaches, but knowing the difference can help determine if medical attention is needed, especially in cases of potential bacterial infection where antibiotics might be necessary. Special considerations for vulnerable populations. Certain groups require extra attention when dealing with stomach viruses due to higher risks of complications. Infants and young children can become dehydrated rapidly, so watch for signs like decreased urine output, no tears when crying, or sunken eyes. Elderly individuals, especially those with chronic conditions, may need closer monitoring as their immune systems are often weaker. Pregnant women should be cautious about dehydration and medication use. People with compromised immune systems, such as those undergoing chemotherapy or with HIV/AIDS, may experience more severe symptoms and prolonged illness. For these vulnerable groups, early intervention and medical consultation are advisable to prevent serious health consequences. Long-term effects and recovery tips. After the acute phase of a stomach virus passes, your digestive system may remain sensitive for several days to weeks. Gradually reintroduce your normal diet, starting with easily digestible proteins like boiled chicken or scrambled eggs before returning to fiber-rich foods. Probiotics from yogurt or supplements can help restore healthy gut bacteria. Some people experience temporary lactose intolerance post-infection, so dairy products should be reintroduced cautiously. Staying well hydrated and getting adequate sleep continue to be important during this recovery period to help your body fully recuperate. When to return to work or school. Determining when it's safe to resume normal activities depends on several factors. Most healthcare professionals recommend waiting at least 24 to 48 hours after symptoms completely resolve before returning to work or school, as you may still be contagious during this period. For food handlers, healthcare workers, or those caring for vulnerable populations, an even longer isolation period may be advisable. Consider your energy levels and ability to perform normal tasks. If you still feel weak or fatigued, additional rest may be necessary. When in doubt, consult with a healthcare provider about the appropriate timeline for your specific situation to prevent relapse or spreading the illness to others. Alternative and complementary therapies. Some people find relief through alternative approaches alongside conventional treatments. Acupressure bands worn on the wrists may help reduce nausea for some individuals. Aromatherapy with peppermint or ginger essential oils, used cautiously, might provide symptom relief. Bone broth contains nutrients that support gut healing, while chamomile tea can have a calming effect on the digestive system. Some studies suggest certain probiotic strains may shorten the duration of viral gastroenteritis. While these methods aren't substitutes for medical treatment when needed, They may offer additional comfort during recovery. Always consult with a healthcare professional before trying new therapies, especially if you have underlying health conditions. The science behind stomach viruses. How they affect your body. When a stomach virus enters your system, it attacks the lining of your digestive tract, particularly targeting the stomach and small intestine. These viruses invade the epithelial cells that line your gastrointestinal tract, causing inflammation and disrupting normal digestive function. As your immune system detects the invaders, it triggers responses like fever to create an inhospitable environment for the virus and increased mucus production to flush out pathogens. Electrolyte imbalance. Why it matters and how to correct it beyond simple fluid loss. Stomach viruses cause a dangerous depletion of essential electrolytes, minerals like sodium, potassium, and chloride that regulate nerve function, muscle contractions, and hydration. Symptoms of electrolyte imbalance include muscle cramps, irregular heartbeat, confusion, and extreme fatigue. This is why plain water alone isn't sufficient for recovery. Commercial rehydration solutions are scientifically formulated with the ideal balance of glucose and electrolytes to optimize absorption. For homemade solutions, the World Health Organization recommends mixing 6 teaspoons sugar plus 1/2 teaspoon salt in 1 liter of clean water. This specific ratio creates the optimal osmotic balance for absorption. Coconut water naturally contains potassium but lacks sufficient sodium, so it shouldn't be your sole rehydration source. Monitoring urine color, aim for pale yellow, helps gauge hydration status, with dark urine signaling the need for more electrolytes. Psychological aspects of stomach virus recovery. The experience of a stomach virus can have significant psychological impacts that are often overlooked. The sudden onset and loss of bodily control can create anxiety, especially in those who've had traumatic experiences with vomiting. This stomach bug anxiety may persist even after physical symptoms subside, sometimes developing into a conditioned aversion to foods consumed before illness. Children in particular may develop temporary fears around eating or bathroom use. Implementing calming techniques during recovery, like controlled breathing exercises or soothing music, can help manage stress responses. For persistent anxiety, gradual exposure to previously enjoyed foods in safe environments can help overcome aversions. Recognizing these psychological dimensions is important for complete recovery, as mental distress can sometimes prolong physical symptoms through the gut-brain connection. Travel-related stomach viruses. Prevention and management. Travelers face heightened risks of stomach viruses due to exposure to new pathogens and potential lapses in food safety standards. Travelers' diarrhea often stems from similar viruses as domestic stomach bugs. Prevention strategies include drinking only bottled or properly treated water, avoiding raw foods, and using alcohol-based hand sanitizers when soap isn't available. When illness strikes while traveling, locate oral rehydration salts, available at most pharmacies worldwide, immediately. Carry a travel health kit with anti-nausea medication, electrolyte packets, and fever reducers. Be extra cautious with food choices during recovery. Stick to packaged foods from reputable sources and avoid street food until fully recovered. Research healthcare options at your destination beforehand. Knowing how to access medical care if symptoms become severe can provide valuable peace of mind. Debunking common stomach virus myths. Many misconceptions persist about stomach virus treatment and prevention. Contrary to popular belief, the stomach flu isn't related to influenza, which is a respiratory illness. Starving the virus doesn't help. Your body needs nutrients to fight infection. Carbonated drinks don't settle the stomach better than flat liquids. Antibiotics are ineffective against viral gastroenteritis and may worsen diarrhea. You can get reinfected with the same virus, as immunity may be temporary. Hand sanitizers alone aren't sufficient. Thorough hand washing is essential. Understanding these facts helps ensure proper care. For instance, while the brat diet is helpful initially, expanding to more nutritious foods as soon as possible actually aids recovery. Similarly, the belief that you'll know bad food when you taste it is dangerous. Contaminated food often tastes normal. Dispelling these myths leads to better prevention and treatment outcomes. Workplace and school prevention policies. Stomach viruses spread rapidly in group settings, making proactive policies essential. Employers and schools should enforce strict sick leave policies, require staff/students with vomiting or diarrhea to stay home for at least 48 hours after symptoms end. Increase cleaning protocols. Disinfect high-touch surfaces, doorknobs, keyboards, faucets, with bleach-based cleaners, as norovirus can survive on surfaces for weeks. Promote hand hygiene. Install touch-free soap dispensers and hand sanitizer stations, emphasizing proper 20-second hand washing. Modify food handling. Cafeterias should suspend self-serve options during outbreaks and ensure sick workers don't prepare food. In healthcare settings, isolation precautions may be necessary for infected patients. Remote work or virtual learning options can help curb outbreaks. Post-outbreak, conduct a review to identify transmission sources and improve protocols.